Talking Head Point and Click Videos presents part 2 of using acceptance and commitment therapy skills to respond skillfully to anxiety. Well, in part 1, we mostly talked about, first of all, that we might want to get clear on what we're trying to do and what we're not trying to do, that we're not trying to make anxiety stop, but respond skillfully to it. And that secondly, where we started was diffusion, noticing the story. So let me say a few more words before we move on to willingness, for those familiar with ACT processes, about noticing the story. So some skillful ways to work with the story would be good old-fashioned journaling. Write out the story. Try to quote the thoughts. It's kind of like step 1 for those of you who have done cognitive therapy. It's just step 1. Quote the thoughts. Write out what your mind is telling you as best you can. And you've already accomplished diffusion. You don't have to do more than that. If you're paying attention, you will notice that the thoughts are a little less powerful to influence your behavior once you've quoted them, once you've specified them, once you've made it clear what it is that your mind is handing you. What's the BS of the day? And then when you do this, it's really a lot like when you tell a therapist how you're feeling. You know, the whole thing, talk about your feelings. Well, why is talking about your feelings so valuable? Well, it can be very helpful to have another human being present, being empathic and so forth. But there may be a much simpler process, more basic process at work of just actually hearing yourself say these things. You are accomplishing, to a certain extent, diffusion or disentanglement from thoughts, as I often call it, and thereby making them less powerful to influence your behavior. There are any number of ways to go with diffusion. You can do exercises where you close your eyes and imagine these scary things happening, the ones that your mind is telling you anyway are going to happen or perhaps going to happen, and imagine them as a movie for those of you who are more visual. So just imagining a movie screen and imagining all those worst case scenarios playing out on the movie screen. Now, this is counterintuitive. A lot of people don't want to do this, especially if they haven't been exposed to ACT before and they don't know what our rationale is. But again, briefly, when we're already thinking it, and when we make it explicit, we disentangle from it. We no longer experience it as the truth from on high, but we start noticing it more for what it is, which is a series of thoughts, mental events happening in the present moment. This is also a process that occurs during mindfulness meditation, and so it is considered one of the ACT mindfulness skills. So with anxiety, it's usually catastrophic thinking of all the horrible, terrible things that are going to happen. I'm going to end up living under a bridge, homeless. I'm going to die alone and unloved. Or anything along the way. Oh gosh, what if that project fails? Oh yeah, gee, what if that project fails? Or maybe sometimes, you know, I'll get this just free-floating sense of, I mean, it doesn't even really have a story, it seems like. It's like, you know, so that's a hard one, but sometimes I'll pose a question. I'll say, and yeah, and so what? So what's going to happen if I don't get anxious? What's going to happen if I don't be really, really careful? Because it's kind of the message is kind of be really, really careful. What's going to happen? Often that's enough there. I don't need to write a pretty story about what's likely to happen. You might in cognitive therapy try to say, oh well, actually you're actually safe. You're actually fine. You don't need to go there. You can just notice that your mind is telling you something that's not particularly helping you. Thanks, mind. Thanks a lot. I know you're trying to help. I know you're trying to help. I picture my mind like a big, dumb doofus guy that just loves me, wants to help me out, but just often has no clue how to be helpful. So also just diffusing from the mind as a whole. Mind as big, dumb dude or gal or dog. Sometimes I think of the mind as like a big, dumb dog. Really loves me, but has no clue how to be helpful sometimes. Anyway, moving along. We said we'd talk about willingness today, so let's begin to touch on that. Willingness, again, is this process, sometimes called acceptance, a little misleading, the term acceptance. It's kind of the idea of having open hands, having an open heart or an openness to your experience, rather than trying to push the experience away, trying to make it go away. Which is what we instinctively do when something's painful, when something's uncomfortable, and anxiety is uncomfortable. And how? So what we automatically tend to do is go into this mode of trying not to have it, as if it were a physical object that we could push away. But there's a funny thing that happens as we're pushing and pushing and pushing and trying to make it go away. Oh, I've got to make this go away. Is it really going away? Is it going away just because I'm trying to make it go away? And am I in any less contact with it for having tried to push it away, for being stuck in that mode of trying to push it away? Am I really in any less contact with it? And what about my hands? Are my hands free to do other things? Or are my hands engaged? My hands, metaphorically speaking. All my effort and my focus is going into this anxiety, and it tends to hog bandwidth. And so willingness is a series of skills involving opening to it. So one way to practice willingness would be to close the eyes, let's say, and take some breaths. They don't have to be deep or special, but just becoming aware of one's breath, noticing where in the body the anxiety resides. There's something physical. There's something sensory. There's a sensation somewhere. Maybe it's in the chest. Maybe it's in the scalp. Maybe it's in the belly. There's some sensations we probably don't like them, so we try not to experience them. But what if we were to meet them where they are? And what if we were to breathe into them and around them and make room for them so that we don't have to grip them so hard, so that we can loosen our grip on them? Allowing them to be as they are and watching them, observing them, participating, observing, noticing whether they're changing in any way for whatever direction they're going, becoming more intense, less intense, changing in their quality, noticing their qualities, if it's a stabbing feeling, a shooting feeling, a sick feeling, whatever it is, noticing its qualities. All of these things are ways of making room for the experience, of relating to the experience in a very different way from just struggle, 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 struggle. And they tend to have a very salutary effect. And we'll move on to other processes that directly suggest ways of responding skillfully to anxiety so that we can live our lives as we like, with anxiety or without it.